Have you ever had an X-ray or medical scan? Two key people make it happen: the X-ray technician and the radiologist. The technician is the one you meet. They operate the machines and make sure you're comfortable and safe. The radiologist is the expert doctor who studies your images and writes a report for your doctor. Think of the technician as the photographer and the radiologist as the art critic. Both roles are essential. One captures the image, the other interprets it. The technician is hands-on, working directly with patients and technology. The radiologist works behind the scenes, using deep medical knowledge to spot problems and guide treatment. Understanding these roles helps you know what's happening during your scan and could help you choose a healthcare career. As we explore these careers, think about which role fits your interests: working with people and machines, or solving medical mysteries. We'll look at what each job involves, the training required, and what kind of person thrives in each role. Whether you love technology or medical problem solving, there's a place for you in medical imaging. Let's dive in and discover where you might fit in this vital healthcare team. X-ray technicians, or radiologic technologists, are the hands-on experts you meet during a scan. They operate X-ray, kinetic, and MRI machines, positioning patients to get the clearest images. Technicians explain procedures, answer questions, and help patients feel at ease, especially if someone is nervous or in pain. They use protective shields to limit radiation and check images for quality, retaking them if needed. Their day is busy and varied, working with patients of all ages and assisting in everything from routine scans to surgeries. Technicians keep equipment clean and follow strict safety rules. They don't diagnose, but their skill ensures radiologists have the best images to work with. Think of them as medical photographers, blending patient care with technical expertise. Without their clear images, accurate diagnoses wouldn't be possible. Radiologists are the medical detectives of healthcare. They're doctors who interpret X-rays, CTs, and MRIs to diagnose injuries and diseases. You rarely meet them. They work in quiet rooms, analyzing images and writing detailed reports for your doctor. Radiologists spot subtle problems, compare scans over time, and consult with other specialists. Some perform minimally invasive procedures, using imaging to guide treatments like biopsies or unblocking arteries. Their training is extensive. They're fully qualified doctors with years of extra study in medical imaging. Radiologists carry huge responsibility. Their analysis guides life-changing treatments. While technicians capture the image, radiologists reveal its story. Their expertise is critical for accurate diagnosis and patient care. They're the unseen heroes solving medical mysteries behind the scenes. The paths to these careers are very different. X-ray technicians usually complete a 2-year associate's degree, learning anatomy, equipment operation, and safety. They get hands-on clinical experience and must pass a certification exam to work. Extra certifications in MRI or mammography can boost their career. The focus is practical skills, preparing them to work safely and effectively from day one. Radiologists, on the other hand, start with a 4-year bachelor's degree, then 4 years of medical school. After becoming doctors, they complete a 5-year radiology residency, and sometimes a fellowship for further specialization. In total, it can take 13-15 years after high school to become a radiologist. This long journey is necessary for the deep expertise needed to make critical diagnoses. Each path suits different strengths: quick entry and hands-on work, or years of study and medical analysis. Salary and work environment matter when choosing a career. X-ray technicians earn a solid income with just 2 years of training and can increase their pay with experience and certifications. They work in hospitals, clinics, and doctors' offices, often on their feet, helping patients directly. Radiologists are among the highest paid doctors, reflecting their long training and responsibility. They work in hospitals, imaging centers, or even remotely from home, focusing on image analysis. Technicians thrive on patient interaction and technology, while radiologists excel in deep analysis and decision-making. If you want a hands-on, people-focused job with quick entry, consider becoming a technician. If you love science, puzzles, and are ready for a long academic journey, radiology could be your calling. Both careers are vital to healthcare and offer the chance to make a real difference. Think about what excites you most: working with people and machines, or solving complex medical mysteries. Your answer will help you find your place in the world of medical imaging.